Epidural during labor. Everyone has an opinion. Some women swear by it, some fear it, and almost every mother-to-be has heard at least one scary story. But how many of these stories are actually true? In today's video, we're breaking down the top myths about epidurals, myths that create fear, confusion, and stress for pregnant women. By the end of this video, you'll clearly understand what epidurals can and cannot do, how they work, and what to expect during labor if you choose to get one. Let's remove the fear and replace it with facts. Epidural causes permanent back pain. Many women believe epidurals will leave them with lifelong back pain or damage their spine. Truth: epidurals do not cause permanent back pain. Most backache after delivery is because of hormonal changes, muscle strain, posture during pregnancy, the pressure of labor itself. Medical research shows no link between epidurals and chronic back problems. Why temporary pain happens. Sometimes the injection site may feel sore for a few days, just like any injection, but this is permanent damage. If you experience long-term pain, it is almost always due to pregnancy changes or muscle strain, not the epidural needle. Epidural slows down labor or stops contractions. Some believe that an epidural will stop labor, slow dilation, or force doctors to use a C-section. Truth: modern epidural techniques use low doses that do not stop labor. Here's what actually happens. Epidural may slightly prolong the pushing stage, only in some women, but it does not increase C-section rates. It helps you relax, which can actually help dilation. Why the myth exists. Older high-dose epidurals created heavy numbness, slowing pushing. Today, light-dose epidurals allow women to move their legs and push effectively. Reassurance: your labor will continue normally. You'll just experience much less pain. Epidural can harm the baby. People worry that medicine from the epidural reaches the baby and affects breathing or alertness. Truth: the medication works locally in the spine. Extremely minimal amounts reach the baby. Far less medication reaches the baby compared to 4 pain medicines or gas. What doctors monitor: baby's heart rate, mother's blood pressure, contractions. All of this ensures both mother and baby remain safe. Reassurance: epidurals are considered one of the safest forms of pain relief for both mother and baby. Myth: getting an epidural is extremely painful and dangerous. People imagine a huge needle going into the spine causing extreme pain or paralysis. Truth: here's how an epidural is actually done. You sit curled forward. Skin is numbed with a small injection. This is the only moment that pinches. The epidural catheter is inserted after the area is numb. Most women feel pressure, not pain. The entire process takes 5 to 10 minutes. Safety facts: paralysis from epidural is extremely rare. It is performed by trained anesthesiologists. It is among the safest procedures in modern medicine. Reassurance: most moms say the pain of contractions is far worse than the tiny pinch of getting an epidural. You want to feel anything and want to be able to push. Some believe epidurals completely paralyze the lower body or prevent pushing. Truth: modern epidurals reduce pain but don't numb you entirely. You can still feel pressure, feel tightening, feel when it's time to push, move your legs slightly. The goal is comfort, not paralysis. Why pushing is still possible. The anesthesiologist adjusts the dose to keep you comfortable but aware. Reassurance: epidurals help you stay calm, focused, and strong during pushing, not disconnected. Bonus tips: epidurals can be adjusted anytime. You can request one during active labor if labor is progressing fast. You may not need it. You can still deliver vaginally. You can walk earlier after delivery depending on the dose. Epidurals don't deserve the fear surrounding them. They don't cause permanent back pain, they don't harm the baby, and they don't stop labor. For many women, epidurals make childbirth a calmer, more controlled, and less traumatic experience. Remember, choosing an epidural is not a weakness. It's a medical option designed to support you. Every birth is different, and only you can decide what feels right for your body. If you found this myth-busting video helpful, hit like, share it with an expecting mom, and subscribe for more pregnancy and women's health education.